Hello everyone. Today we'll be talking about bempedoic acid. So bempedoic acid is a new drug which has came for the management of dyslipidemia. So as you all know, dyslipidemia initially was used to be treated with using statin therapies, azithromycin, and PCSK9 inhibitors. So there is a new drug which has been came into picture. It's called as bempedoic acid. Its mechanism is similar to the action of statins. That is, it decreases the cholesterol synthesis. So normally, as we all know, the statins acts by reducing the HMG-CoA reductase. So this is an enzyme if it inhibited by the statin therapies, and thus they decreases the production of cholesterol here. So now before this HMG-CoA, so HMG-CoA precursor products are acetyl coenzyme A, and this acetyl coenzyme A comes from the citrate. So normally what happens is that the cholesterol is actually synthesized in the liver, and basically it is synthesized in the endoplasmic reticulum of the liver cells. So from and for it to occur, so acetyl CoA is transported from the mitochondrium to the cytoplasm as citrate. So to go for citrate to go into the acetyl CoA to go into the endoplasmic reticulum, it is released from the mitochondria into the cytoplasm in the form of citrate. And this citrate is converted into acetyl coenzyme A, which is a pre-product for cholesterol synthesis by an enzyme called as ATP citrate lyase. So this enzyme is inhibited by bempedoic acid. So if this enzyme is inhibited, there will be decreased production of acetyl CoA and thus decreased production of the cholesterol. So its mechanism is similar to that of statins. So important thing to be noted is that this is role is similar to statins, and thus it reduces hepatic cholesterol synthesis and raises. So because now whenever there is decrease in hepatic cholesterol synthesis here, the cholesterol, if it is levels are decreased in the liver, what happens is that the LDL receptor starts increasing more and more, so that LDL go into the liver to maintain this cholesterol synthesis. So there will be increased uptake of the LDL from the circulation into the liver, and thus there will be decreased LDL cholesterol levels from the circulation. However, important thing to note that statin has a limitation that statin also acts on the skeletal muscles and can cause myopathies, which is a common side effect of the statin therapies, which is not seen with bempedoic acid because these are activated. It is a prodrug and it is activated only in the liver and not in any of the peripheral tissues. It has a half-life of 21 hours, that is a single daily dosing will be sufficient, and it is absorbed mainly in the small intestine. And after giving an oral drug, it takes for the drug to reach the peak blood concentration level, it takes around 3.5 hours. Also important thing to note that the absorption of bempedoic acid remains unaffected by food, so it has no relationship with the food. It is metabolized primarily in the liver and is eliminated through the kidneys. The dosage of bempedoic acid is 180 milligrams once daily in combination. You give it in the combination with the maximum tolerated statin therapy. So this is still upcoming drug. So it has mainly been studied with along with the statin therapy, the maximally tolerated statin therapy. Addition to that, this drug has been given and has been done, various trials has been done now. Important to note that the adverse effects of this is hyperuricemia. It causes a hyperuricemia significantly, and which may lead to gout as well. So this drug should not be used in patients with hyperuricemia or gout patients. So various studies have shown that if bempedoic acid alone is used, it has a LDL lowering of around 23.6%, which has been seen. It was seen in the Clear Serenity trial after the 1 year of follow-up. That is, after 1 year, if you give this drug, the LDL cholesterol level decreases by 23.6. Now, if you combine it with the maximum tolerated lipid therapy, it was found to be 18%. Combining with ezetimibe showed that 38% reduction. Combining with the statin, ezetimibe, and the bempedoic acid, there is 60.5% risk, that is LDL lowering level effect is seen. Whereas when you combine it with PCSK9 inhibitors, 25% reduction has been noted. So coming to a specific patient population, renal impairment, because this drug is majorly excreted from the liver, majorly excreted from the kidneys, there is still, if the EGFR is more than 30, there has found to be that no dose adjustment is required in this group of them. If the EGFR is less than 30, the study has not been done much. So for in this patient, we need to be a little bit careful about the dosing because the studies has not been done in this group. Hepatic impairment, dosage adjustment are not required for patient with mild to moderate impairment. That is Child-Pugh classification A and B. There is a dose adjustment is not required. In class C, this has not been studied, so we cannot comment on that whether the dose should be reduced or whether it can be used in this child puke class C patient is not. This is important. Pregnancy and breastfeeding is another important topic where this drug has not been studied, so it is contraindicated in this population group. So it was the first one landmark trial called as Clear Harmony trial, which has seen the safety and efficacy of bempedoic acid when compared to. So what they did is the baseline, all the patients who are on the statin therapy, and based on that, on half of the patient they have given what is called as bempedoic acid, and the remaining half the patient they have given placebo along with the normal statin therapy, and they found that there was 18% reduction in LDL cholesterol level was found to be 18%, and it was found to be safer, and lesser side effects was seen when compared to that of compared to the statin therapy. So that means the placebo, when compared to placebo, the outcomes, adverse events were similar in them. So this is a new study which has been done recently, Clear Outcome Trial. This was basically done to see the cardiovascular outcomes. Primary outcome was seen. This was basically done in the patient of statin intolerant, like who are not able to tolerate the statins. In those patients, they have given only bempedoic acid for dyslipidemia, and they've tried for they've seen for around 40 months of follow-up was done, and they tried to see the primary outcome was cardiovascular major adverse cardiovascular event reduction, and it was found that treatment with bempedoic acid was associated with a lower risk of major adverse cardiac vascular events when compared to placebo. However, further trial and still this has not been applied in any of the latest guidelines, and maybe in the coming guidelines it may this drug may be added as a class 1 recommendation for statin for dyslipidemia. So important thing to note is that till now only the phase 2 and phase 3 trials has been demonstrated and just shown a very promising results. And various drugs therapy is and trials are required to assess its role in major cardiovascular events reduction. So now, till now, the recommendation only is to use it in patient in whom the LDL cholesterol levels are still high, despite on being maintaining of maximally tolerated statin therapy. And this use was recommended by the FDA approved drug. Thank you.